Hey, I'm Dr. Bryan DiMarco here at Renew Dental. We get a lot of questions about dentures. So today I'm here to answer a few of the most common questions that we get and hopefully give you a better understanding on the subject of dentures. So the first question we get is, what are dentures? So dentures are a dental prosthesis that's used to replace teeth in your mouth. Usually with dentures, they're either removable or sometimes they're a fixed denture, meaning that they stay in your mouth. So what type of dental professional would you see about getting dentures? So dentures can be done by either general dentists, or you can also go to see a denturist to get a denture made. So the next question we'll get asked is, when would a dentist recommend getting dentures? So usually I recommend getting dentures when a patient has multiple teeth that are missing, and other options such as dental implants or bridges might either be too expensive or too time consuming for that patient. A fallback option would be that we could make some dentures in order to replace their missing teeth. So when would these other options be appropriate? So for a dental implant is usually going to be the best option that we have to replace missing teeth. They do have a few requirements in terms of we need enough bone in the area in order to actually place the dental implant. And then the other part of it is finances. If both of those aren't an issue though, dental implants provide the best option to replace teeth. Because they're fixed in your mouth, they're very similar to a natural tooth, which gives you the best use and function long term. They also have a great appearance as well, which can make them look very similar to natural teeth. So the other option that we have is doing a dental bridge. So a dental bridge is a good option if we have teeth that have a lot of work on them and we have, say, two teeth with one missing tooth in the middle. The bridge can be placed to cover those two teeth while being connected to one in the middle to give you a replacement option for that tooth. A bridge, though, isn't a great option if your other teeth are relatively healthy, because to put a bridge in place, we have to cut down those other teeth, which can lead to issues in those teeth, as well as bridges tend to need to be replaced a lot more often than an implant would. So what type of dentures are there? So there's two main types of dentures. We have complete dentures and partial dentures. So complete dentures, as the name suggests, mean that we're replacing all of the teeth with the denture. A partial denture means that we only have some teeth that are remaining and we're going to be replacing the missing ones with that partial denture. When it comes to the complete dentures, we have a few different options. So the first one is your traditional denture, which is a removable denture made out of acrylic. The next option we have is what's called an overdenture. So that means that we have a couple of implants in place that your denture clips onto. It can still be removed, but the implants add some added retention so that your denture doesn't come out. We typically use this for bottom dentures because they don't really fit that well. The last option we have is what's called a fixed denture, or an all-on X denture. And what that is a denture that's actually attached to multiple implants in your mouth and doesn't come out. With that type of denture, it's a great option in terms of replacing all of the teeth, but does have quite a large price tag associated with it. When it comes to partial dentures, we have two main types. So we have acrylic partial dentures and cast metal partial dentures. So acrylic partial dentures are made out of plastic. We generally don't like to use these types of dentures because they don't tend to last very long term. So we would use these dentures more in a situation where, say, someone is missing a single tooth and needs what's called a flipper denture, which is kind of like a temporary denture to replace a single tooth until they're ready to do a more permanent option like a dental implant. The other type of partial, which is more common, is that cast metal partial. The cast metal has a metal framework in it and then acrylic on top to look like natural teeth, but the metal provides a lot more strength to the denture. So it's a better option in terms of longevity to give you a good option to replace those missing teeth. So the next thing patients will ask us is, how are dentures made and what materials are used? So in terms of how dentures are made, they're made with doing appointments at our office and then also in conjunction with a dental laboratory. So usually we'll have multiple appointments where we go through different stages of making the denture, and in between that, the laboratory will process the denture and get things ready for the next appointment, going through the sequence until we have the final product. In terms of materials, so I kind of mentioned that a little bit in the last question, but the most common ones used are acrylic. So that's the pink kind of plastic looking material that you kind of think of when you think of a traditional denture. And then the other one that I mentioned with partial dentures is that we will have some metal that's used to strengthen the structure of the denture and make it last longer. So the next question we get asked is, what happens during the denture placement procedure? So again, this is going to vary depending on what type of denture you're getting, but if we're getting one of the more simple removable complete or partial dentures, usually during that appointment, we're just going to be trying it in, making adjustments to make sure it's comfortable on the gums. We're going to check the bite to make sure everything is lining up properly. And then lastly, we're going to check that you're happy with the appearance and that you're able to speak normally. So the process of making dentures it really is quite painless. It's really getting the teeth removed that's the worst part, and usually patients have already gone through that. So making dentures is usually a relatively simple process. So patients will ask, are there any anesthesia options available during the denture making procedure? So during the denture making, like I mentioned, it's a relatively simple procedure. We generally don't have to give any anesthetic. The only time we would usually look into that is if later on we are placing some implants as well, then absolutely we are going to give you some local anesthetic to freeze up the area. And then we can talk about some sedation options as well, whether that's going to be an oral sedative or looking at something like some nitrous oxide gas sedation or laughing gas so that we can make you as comfortable as possible. So the next thing patients will ask us is, how will my dentures look and feel? So in terms of the look, we are going to make them look as natural as possible. They are resin teeth, so there's limitations to how good they can look, but most of the time we can get quite a good result. So in terms of how they feel, for most patients, there is going to be a bit of an adjustment period when they first get their dentures. Usually after a few weeks and a few adjustments, generally we can get the dentures to fit quite well and be fairly comfortable. There are some patients, though, that don't like the feeling of the extra material in their mouth. And for those patients, that's where the options of a dental implant or a bridge would probably be a better option for them. So patients will then ask, is it going to be more difficult for me to speak with dentures? So when we're first getting used to dentures for the first few weeks, it is very common that patients can have a bit of a lisp. But as they get used to wearing the dentures and the muscles in our face get used to having dentures in your mouth, generally that lisp is going to go away and it isn't a long-term issue. Patients will ask, will having dentures affect my ability to eat or drink regularly? So in terms of having dentures versus not having them at all, they should significantly increase your ability to eat and chew. When you're missing multiple teeth, it can be very difficult to actually properly chew and digest your food. In terms of the dentures themselves, they do have some limitations. So with partial dentures, usually we're pretty good to eat most type of foods because we have the support of the other teeth. So that denture is pretty solid in the mouth. When it comes to complete dentures, you do need to be careful in some foods that you're eating. So when we're eating foods in the front of the complete dentures, that can cause them to tip out. So kind of chewing into an apple or a steak may be a little bit difficult, but for most patients, as long as they chew with the back teeth, maybe cut it into some smaller pieces, they generally don't have too much trouble with eating. So once patients have their dentures, they'll ask us, what's the best way for me to care and clean my dentures? So the best way is going to be that when you go to brush your teeth at night, or if you don't have any teeth, when you're taking out your denture, is that you can clean it with a denture brush and some water. If you do want to clean it a little bit more, you can also use a bit of hand soap as well. We always tell patients never use toothpaste on your dentures because it does have abrasives in it that can scratch up the denture and make little scratches in it long term. What I would then recommend is that overnight you soak it in a denture cleaner so that in the morning when you wake up and you've brushed your teeth or cleaned out your mouth, your dentures are ready to go for the day. So what special care do patients need to take once they get their dentures? So once you have your dentures, one of the main things is that you take it out at night. We don't want to leave the dentures in all the time because that can cause the tissues to get quite irritated and red. They need time to rest every day, so taking them out at night provides adequate rest for those tissues. The other thing that you should do is make sure that you do continue your regular visits to the dentist. So if we have a partial denture, we still have teeth left that we need to make sure we clean and keep healthy, because if we end up losing some of them, the partial may no longer fit and then we might need to get a new one. The other thing is for complete dentures, a lot of patients think, okay, I have my complete dentures, I don't need to go back to the dentist. But what we're doing is that every 6 months, we still need to see you to make sure that we can look at your mouth, make sure all the tissues are healthy, make sure there's no signs of oral cancer, and make sure those dentures are fitting properly. The issue with dentures is because they're sitting on your gums, they are going to cause your bone to resorb or shrink over time. So if the denture isn't fitting properly, that can actually make that resorption happen much more quickly. So we want to make sure that the denture is fitting properly and that we can do what's called a reline, which is adding material to that denture before it becomes a bigger issue and we have to remake your denture. So patients will ask, how long will my dentures last? So with dentures, they do need to be replaced on a fairly frequent basis. Generally, I will tell patients they're going to last probably anywhere from about 5 to 7 years before we need to make you a new pair. So patients will then ask, what do I do if my dentures need restoration, replacement, or repair? So if you need a repair to your denture, you can let us know. We'll get you in. And generally, most issues are fixable. We just need to take an impression of the denture, send it to the lab, which you can usually get it back to us the next day, and we can make a repair. If the damage is too significant and we can't fix it, then yes, we can talk about making you a new pair. Generally, that is going to involve all the same steps that we had to do for the first one, but there are a few scenarios where we might be able to make it a little bit quicker. So patients will often ask, how long will it take for my mouth to heal and for it to get used to my new dentures? So generally the first 2 to 3 weeks are when you're going to be getting used to these dentures and everything is adapting to those dentures. With dentures, it's very common that you will get some sores that develop, and all you have to do is let us know. We'll get you in for an adjustment, and usually after a few adjustments, the dentures are fitting comfortably and you're good to go. So patients will then ask, what is the cost of dentures and will my insurance cover them? So with dentures, the cost does vary quite widely depending on what type of denture you're getting. General range for the complete dentures would be roughly about $1,400 to about $1,700. With partial dentures, because of the metal, usually about $1,700 to about $2,000 per denture. When we start looking at the other types of dentures, such as the one with implants, the cost does raise significantly and does vary on an individual basis depending on how many implants are needed. In terms of will insurance help pay for the dentures, so dentures are considered a major treatment, and some insurances do cover it, but at a lesser percentage than your normal basic treatment, such as cleanings and fillings. And then there are some out there that will not cover it. So again, if you're interested in dentures, bring in your insurance. We'll try to help you navigate that as best as possible. All right, well, I hope I was able to answer some of your questions about dentures. If you do have any other questions or you are interested in looking into dentures, feel free to give us a call at 204-817-6768, and we'd be happy to help you.